thank you very much to Aditi Shah. So warm welcome. Aditi is a GP in Merton. She's a busy working mum with a young children, like many of us, juggling the sort of life that we live, homeschooling, childcare, limited childcare that we have. And she's worked in the Merton area for 8 years. And then we have Dr. Agnelo Fernandes. He's been a GP in Thornton Heath for 30 years, so in the Croydon area. And again, facing a lot of the challenges that we all are through this difficult time.
Thank you, everybody, for joining today. I think Agnelo and I are really pleased to be here. I'm, as my colleague said, I'm a GP in Merton, and I'm one of the clinical leads at the CCG, but more importantly, I'm also a mum of 2 young children, and I think we all go through decisions of different things, and I imagine that this is a decision that you're making as well, and I'm hoping that we can answer some of the questions that you've got, give you some of the information, and arm you with that information to make the correct choice for yourself and also for the population as well. So really pleased to answer any questions that you have, and I think we should just kick off with that, really go through the chat and questions that you have as they come along.
Thanks, Aditi. And that might be a good place to start with, because we had a few questions who came in advance wanting to know, is it safe? I'll put the 3 together because they group together. Is it safe to take the vaccine if someone's planning a baby? And how would it affect people who want to get pregnant in the near future, as there seems to have been some conflicting messages? And is it safe to take the vaccine if you're pregnant?
So at the moment, there are certain people who are advised to have the vaccine. So it's perfectly safe to have in pregnancy, and if you're breastfeeding. However, there are people who are more at risk. So it may be frontline health and social care staff, and also those who have underlying medical conditions and who are pregnant are the ones that we're giving the vaccination to at the moment. So yes, the initial trials weren't done on lots of pregnant women, but lots of pregnant women have had the vaccine where it's required, where there is a risk in terms of their job or because of their underlying health. Those are the women that are being vaccinated that are pregnant. So in this case, it's really important to speak to a healthcare professional and weigh up the risks and benefits of having the vaccine if you're pregnant, but it's really important to go and speak to the healthcare professional that's looking after you to have that discussion. And certainly if you're in a setting where you're looking after patients, then it's obviously really important to protect yourself in that way.
Thank you. And if you're breastfeeding, is it safe to have the vaccination?
Yeah, so you absolutely. So I've got a baby myself. I had the vaccine a couple of weeks ago, and I'm also breastfeeding. It is safe to have both of the vaccines whilst you're breastfeeding. And again, lots of women have had it when they're breastfeeding as well.
Thank you. Thanks, Aditi. Lots of questions about the side effects. If we could know about what the side effects are, what are the side effects that are expected? Is there known side effects for BME people in particular? And can it be worse? Can the side effects be worse than the symptoms of COVID? So perhaps we go to Agnelo for this one.
Yeah, so first of all, I did have COVID, and the first time in 30 years that I've been off for 5 weeks. So it's a pretty nasty disease. So I've also had the COVID vaccination. I can tell you that was nothing as bad as having the disease. In fact, my uncle and aunt who are in their 90s had the vaccine. I was dreading ringing them up the next day, thinking they're going to be unwell. But actually, they didn't have any symptoms at all. So you have that extreme of people who have no side effects at all, and those are the vast majority, or the average number of people who have a bit of soreness in the arm, like with any vaccine. There are going to be some that get a temperature and feel unwell, get a headache, but that usually settles down within 48 hours. So those are minimal side effects that we would expect with any vaccine.
Thank you. And is it likely to be any worse in people who are from a BAME background?
No, I think I fit the BME mold. And certainly the number of people of all ethnic groups that have taken the vaccine, there's no evidence that it's any different in anybody.
Thank you. We've then got a question about, once you've had the vaccine, can you still transmit COVID to other people? Will I still have to wear PPE? Will I still have to do the social distancing and the testing and isolate if I come back from somewhere? So we go to Aditi.
Yeah.
Thank you.
Today.
Great. Even when you've had the COVID vaccine, it's really, really important to follow the guidance that we have been doing all along, which is making sure that you wash your hands, that you wear your face mask, that you keep your social distancing, and that's really key. You might have seen in the news and the media them worrying about people sort of becoming a little bit dropping their guard, and it's really important that we don't drop our guard. This is a fantastic positive step to have the vaccinations there, but we must all keep doing the same thing we've been doing all along, which is to practice the social distancing, washing our hands, and the face mask. In terms of catching COVID and passing it on to others, you must self-isolate if you get the advice to do so. So if on your app you're told to self-isolate, then you should do so. If you get some sort of other notice saying that you've been in contact with someone with COVID and they're asking you to follow the advice, then you must follow the advice there. So those things at the moment wouldn't change, but it's really important to follow that isolation advice if you have it. Does that answer all the questions you had, Vicky? You had a couple of questions there.
Yes, I think that captures it all, doesn't it? So there still is a risk you can transmit it. I think that's where it had started from, isn't there? Yeah.
I think we ought to say also it's a new virus, a new vaccine, so there's studies still going on, and so the advice is to carry on with all the infection prevention control until we know more, because the one thing we do know is that the vaccine prevents you having serious disease. We don't know whether it eliminates carriage of the virus asymptomatically. So that's why studies are going on, and we need to carry on doing the infection prevention control.
Thank you. The next question is one that some people have said that they believe that there's a separate vaccine for Black people than for white people. Is that the case?
There's a simple answer to that: no. The vaccines were tried on different ethnic groups in the trials, whether they were white people, Asian, African, Afro-Caribbean, Latinos, and different Asian groups as well. So the vaccines have been successfully in 5 different countries as well.
Thank you. And the next question is, how's the vaccine been rolled out so quickly compared to other vaccines that take years of trials?
I think we've had a lot of background work going on for this. For years and years, scientists in the background have been preparing, and we've got the knowledge and the background for that. We've also got the knowledge from other vaccines and how they're produced. And so when this came round, we had that information already to hand, which meant that we could try and get these things launched faster. Also, the funding, the effort from multiple people, from the scientists to the people who make the vaccines, was all in place all at the same time. So it meant that there was a whole global effort to launch this and get it to all of us. And so that's why it's been the speed that it has. However, there has been rigorous evaluation and testing and making sure it's safe, and looking at all the safety data. And so just because it was speedy, that doesn't mean that there's any concerns in terms of the safety. A lot of effort has been gone into looking at the safety aspect as well, and making sure it's safe for all of us to have. It's almost like if you were preparing a recipe, you've got all the ingredients sort of in the background, and you're just waiting for the go ahead to know what you're supposed to be making, but you've chopped up the vegetables and the meat, and then you're told what to make. And that's sort of the way that this has been done. So the preparation has been there in the background.
Thank you. It's a helpful way to look at it, I think. So some people have said, does this vaccine contain any microchips, and how can you be sure that there aren't any?
So I think there are simple answers to some of these questions. The answer is no, there are no microchips. This is fake news on WhatsApp groups and social media. And why should there be? There's absolutely no microchips or nanobots or anything else. So people take words out of context. So the term was called nanoparticles, which were the way that the Pfizer vaccine is preserved and transported. So the RNA vaccine is within a fatty layer, and it's called a nanoparticle. So this is not to be mixed up with nanobots and robots and microbots and all the rest of it, because there's nothing to do with any monitoring devices.
Thank you. And there's another thing I think along the same lines is that I've heard that the vaccine can alter your DNA. Is this true?
So I heard Agnelo give a wonderful description of this earlier, so I'm going to let him answer this. I thought his answer was very, very helpful. So I'll let you answer this one, Agnelo.
I've given a number of different versions to that, but people will remember from their basic biology at school, the DNA is in the cell nucleus and it makes RNA. RNA can't make DNA or alter DNA. Therefore, there's no way that the vaccine, like the Pfizer or the Moderna, can affect the DNA. So the other analogy I used was a mother gives birth to a child, but the child can't give birth to its mother.
That's a helpful way, I think, to look at it, isn't it, and to explain. There's a couple of practical questions which I can answer them later, and so just someone saying, you say that the vaccine is safe and effective. How do you know it's effective, and especially only after one dose? So this might be also looking at the first dose and second dose, so efficacy that it provides.
So there has been lots of safety data. Lots of people have looked at the vaccines and the data from the trials to make sure that it is safe. And so the MHRA is one of the organisations that looks at the data in this country, but also worldwide. There have been organisations looking at the safety of the vaccines available as well. It's really important that you do get your 2 doses of the vaccine. You will get some protection with the first dose, but it's important to make sure that you get your follow-up dose when you're advised to do so. So most people will get a recall of their appointment. Once they've had their first jab, they'll get one 12 weeks later through whichever centre they had their vaccine through. In terms of how the efficacy data, so once you've had your vaccinations, the Pfizer vaccine gives you 95% protection. However, that doesn't mean that you should stop doing the things we said. As we said before, it's really important to keep your social distancing, do all your infection control procedures just as you would have before, and that's really, really important there.
Thank you. We've then got some questions about immunity, and I'm just going to mute everyone again. I'm sorry, because I can hear some background noise. Maybe people not familiar with the Teams. So I'm going to mute everyone. So Agnelo and Aditi, you'll obviously have to unmute yourself again. So the next questions were about immunity. So if you've had the vaccine, how immune are you? What level of immunity do you have? And if you've had COVID in the past, what level of immunity do you have?
Agnelo, you're on mute.
Sorry, I just had muted people because there's background noise.
So when you get an infection, when you get COVID infection, you get antibodies against coronavirus. But what the studies are showing is that after about 5 months, it's gradually reducing. We don't know how low it'll get to. So just with having had the disease, your antibody level is going to go down. However, what the study also shows that after vaccination, the antibodies remain high, and it's anticipated the antibodies will remain high, so give you protection for at least a year. That's what the hope is. We haven't got to that stage yet because the vaccine's have only been out for a few months. But it's hoped that it'll be at least a year, if not more. So we don't know the answer to some of those questions, but even a year would be a significant amount of time. We know that the flu jab is every year because the virus has changed. So we don't know whether the COVID jab will be annually either. But at this stage, the COVID jab definitely gives you more protection than just having had it on its own to produce the antibodies.
Thank you. There's a question here around, it said that it is not mandatory, but I also hear that you'll need to show proof of vaccination when you're traveling overseas. I'm not sure if you have a response for that.
So it's not mandatory. This has to be a decision that you make yourself. Obviously, from my perspective, I think it's a really, really important thing to do to protect yourself from severe disease when you have the COVID vaccination. I think to protect against that is really, really important. However, it is not mandatory in the UK to have the vaccination. As for travelling, it's going to vary according to which country you go to and the policies that they have. So I'm not sure that we can answer that as a sort of blanket answer, and it will depend on the advice each country has in terms of that. So you would have to check the guidance, just like our Foreign Office has guidance. There will be travel advice for each country in terms of what they expect to happen. But whilst it's not mandatory, I think it would be great and if you could consider it, because I think it's so important in terms of protecting yourself in terms of the severity of the disease that COVID-19 could cause.
Thank you.
Can I just add to that, because it's an evolving situation at the moment. It's not mandatory in the UK. However, in terms of travelling, we already know that there are countries you need to go to. You need to have a certificate for vaccination. So yellow fever is one of those. To go to certain countries in Africa or Asia, you need to have a yellow fever vaccination before they let you in. And there's certainly a lot of talk about having a coronavirus passport, a vaccination passport, which your card will be if you've had your vaccination. So there is certainly more countries now considering that than they were even in the last couple of weeks. So I think from a travel point of view, then we've got examples of other vaccines that are mandatory for you to travel to different countries as well. So I think you can assume there will be a number of countries that will look for confirmation that you've had the vaccination.
Thank you. Yeah, that's a useful way to think of it, isn't it? We do get vaccinations for other diseases to visit the countries. There's just a few questions coming in about how do I get a vaccine and the rollout. Well, I'll just respond to them and then we can go back to the clinical questions. At the moment, so all health and social care workers are eligible for vaccine if you are a client or patient facing. So I think that's probably everyone on this call has been invited because you either work for a domiciliary care, social care or care home. So any staff member in a care home and any of the client facing domiciliary care or social care staff. So there are places available now. You can get an appointment tomorrow. So if I've put in the chat the email address that you need to email, either the home care one if you're a home care worker, or a care home one if you're a care home member of staff. If you send your information through, and we will then be able to either give you a self-booking link for one of the hospitals or get you into one of the clinics at the GP clinics where they have capacity in the clinics. So please, I'd urge you to do it. Do it today, straight after. Even while you're doing listening to this, get yourself in so we can get you into a COVID vaccine appointment as soon as possible. There are vacancies this week that we can get you into. Next question, the clinical question. If someone is tested positive, after how long can they have the vaccine?
I don't know whose question it was, but essentially, if you've had, you need to wait 28 days from the time of your illness has been the guidance. That might change in the future, and you might be able to get it sooner. But basically, if you've had COVID, the recommendation is to wait 28 days. That's so that in terms of the symptoms from the actual COVID vaccination of COVID compared to the COVID vaccination, there's sort of a gap between the two. That said, if inadvertently there's a shorter gap, then it shouldn't cause too much of an issue. But the guidance is, if you can, 28 days between the two. Thank
you. There's someone who's got an elderly mother showing signs of dementia who is vaccine resistant. So she is not, or he. The mother has received a letter of referral and said that she's not interested. What can I do to inform and encourage her to get vaccinated?
So again, if she's got dementia, there will be a power of attorney, maybe with a relative, and that discussion with the relative if she's not able to assimilate the information to make an informed choice. And so in the first case, it will be in terms of discussing with the power of attorney. If the power of attorney also feels that they shouldn't have the vaccine, despite a conversation, then there is the option of the best interest of the patient as well to consider. And these are conversations that are live at the moment in almost every care home, where you've got patients, and soon when we start doing the housebounds as well. So there are different options to consider, but information and conversation are really important in that decision making, keeping the patient at the centre of that discussion and that decision making.
Thank you.
Sorry, Vicky. Can I just add here that if that lady has not been diagnosed with dementia but is showing signs of dementia, how can you then encourage her if she doesn't have a power of attorney? So
if she's able to make an informed choice, and she's able to retain the information, can understand the information, and makes the decision based on the information that she's got, then you've got to observe her wish not to have the vaccination.
Thank you. I think so the next question is a little bit about the vaccine. So they're asking which vaccines are being rolled out. So across Southwest London, which includes Wandsworth and all Southwest London boroughs, it's currently the Oxford and the which is the AstraZeneca, or the Pfizer vaccine are both being rolled out. So are you able to explain the pros and cons of each? Is there a difference between them? And yeah.
So I think in terms of which one you have, for most people, it doesn't matter which one you have. There are a few people who, if they have a specific allergy to the the contents, the ingredients of the Pfizer vaccine, then that's the time that you can't have it. And there's a specific list of things there which can be provided to you if you are concerned about that. The other is if you allergic to 2 or more different families of drugs and have very severe reactions to those, then it's really important to discuss it with a healthcare professional. In terms of which one to have, lots of people have said, which one would you choose? Which one would you go for? I'd go for either of them. If I had the AstraZeneca one just because that was the one that was there on the day, and my husband had the Pfizer one because that was the one that was there on the day, and we were both fine after having it. I had a little bit of a fever and felt a bit fatigued for 24 hours, and my husband was watching the football and quite frankly was completely fine with it and didn't have any symptoms at all. So for most people, I would say it's go with the one that's available there to you, and that might be different depending on the vaccination site that you go to. There might be specific groups, as I mentioned, that I might have to consider one vaccination over another, such as if you have an allergy to the ingredients. But on the whole, most people can have either of those vaccines there. Agnelo, did you want to add to that?
Yeah, so the other question that people are asking in the chat, and it'd be good if we can start addressing some of those in the chat as well, is that can you mix the vaccines? The current guidance is if you have a Pfizer vaccine as a first dose, you have a Pfizer vaccine as a second dose. The same with the AstraZeneca one. And I think the key message is whichever vaccine you're offered is have it. It's because they're all just as effective and they're all safe. And the most importantly is to get as many people with some degree of protection with the first dose, and that's the reason why we've extended, well, the government and the PHE, not in fact the government, but in terms of the Public Health England, the experts have allowed the lengthening of time between the first and second dose, which makes perfect sense. And I think it took a lot of us to get our heads around that because we felt that it should be within the time frame, but actually now that you think about it, it's absolutely the right decision in terms of getting as many people with protection rather than fewer people with the same number of doses. So I think that's the only thing I'd like to add to that.
And I think there was a question about why did we go, why have we not vaccinated everyone, and why have we started with certain groups? Well, we started with the groups that can be most vulnerable and at risk from COVID, and we're working down the groups. So the JCVI, which is the organisation that has come up with the groupings, has given us an order in which to vaccinate people. That's why we're not vaccinating all age groups and all different age groups all at the same time, but we're going in order. So we started with the people over 80, as well as then going to the healthcare workers and frontline health and social care, and then we're working down the list that way. So now we're working towards people over 70, and so we're working our way through that group slowly but surely.
Thank you. There's a few questions coming in. I'm just trying to group together things around allergies. So people worrying about people who have skin conditions, people who are allergic to penicillin and takes ferrin inject. Are any of those things that would be issues in terms of allergies to prevent them from getting the vaccine?
So if you're ever concerned, it's important to speak to a healthcare professional. But in short, if generally, if there's a penicillin allergy, you should be absolutely fine to take either of those vaccines that are there. If you've had a severe anaphylactic reaction, then and you carry an EpiPen, then by all means speak to a healthcare professional before you have the vaccine, and it might be an idea to take your EpiPen with you. But if you've got sort of a single food allergy, which is very mild, then that shouldn't be a reason to not take the vaccine. So absolutely, for most people, it should be perfectly safe. But if there's any concerns you have about a severe reaction, then speak to your healthcare professional before you have the vaccination.
Thank you. They're saying, one of the questions, what are the employment risks for those who refuse the vaccine?
So it's not mandatory in the UK, and it's not likely to be either. But again, employers might take a different tack on that. As you know, Victoria plumbers came out with the fact that they want all their plumbers to be vaccinated. And the reason for that is they're going in and out of people's homes, and they don't want to take the virus into people's homes, and that's why they want all their workers vaccinated. Now, again, different employers might respond differently to that, but as a country, and there's not going to be a law to say that everybody's going to have it. So these are evolving decisions, and different employers might take a different view on that. Because the whole aim of vaccination is to protect the individual, to protect the people they work with, protect their own families, but also to protect the community. So there's a number of different reasons why vaccination is being promoted. But it is an individual choice, and we're not here to say that force people to have it. We're here to give people information, factual information, not WhatsApp information, on what the facts, and help people make informed decisions and informed choices.
Come and help me.
Thank you. I'm just going to have to mute everyone again. Sorry, there's a bit of background noise. People have got their microphones on. So,
and Nikki, Vicky, just to add to that, if whether people have the vaccination or not, they should still have access to the correct PPE that they've been using in whichever environment they've been working in. So that doesn't change whether they have the vaccination or not. That the access to that should still be there.
Thank you. I'm just going to press mute. So Agnelo and Aditi, please unmute yourself. We just had a couple more questions. People with sickle cell disease, people with celiac disease, are they able to have the vaccine?
The simple answer to that is yes. If they're in a sickle cell crisis and they're unstable, then for them to discuss that with their specialist. But in general terms, the answer to that is yes.
Thank you. Got a few questions. People are asking about how I can get the vaccine. So at all the social health and social care workers who are patient facing or client facing are in the priority group. You can get a vaccine now. Thank you. Tom's just put in the email addresses, both home care, or it's the carehome.covid vaccine one if you work in a care home. Someone asked me, is there going to be enough vaccines? I've seen the delivery plans. There certainly is a lot there, and we have got a lot of appointments still available this week for people who work in social care. So please register yourself. We can get you appointments this week. We can get you them tomorrow, maybe even this evening if on some of the self-booking links.
You might see one of us vaccinating as well. So we might get to see you in person rather than on a screen.
That's right. So just trying to group questions together. So I think there's still quite a few questions coming in about people saying, will I still have to isolate? Will I still have to practice the sort of distance? Will I still have to do the COVID tests weekly once I've had the COVID vaccine? And yes, you will, won't you? I know we've been through that, but I think people joining it as we go on.
Fair point. When people say, well, if I'm going to have the vaccine, I still have to do everything I'm doing now. What's the point of it? Well, the rationale for that is, one, we don't know the answer because studies are being done. But two, when we get 70 to 80% of people vaccinated, then we'll have vaccine herd immunity. And then the virus in the community actually goes down because it's not being transmitted as frequently. And then we can reduce all the infection prevention areas. And, also the country can come out of lockdown, and the restrictions that we've got at the moment will be lifted. So at this moment in time, just one person having the vaccine is not going to make a huge difference to the community. It will make a difference to that individual and their families and their contacts. But everybody practicing the infection prevention control measures is important. But there'll be a time when the virus that is circulating is down, and having had the vaccine, you'll be protected as well, and the restrictions will be removed.
Thank you. And I can see Ines has asked a question about why are we not in a position to choose the one we want. What I would say, particularly if you're allergic, is when you make your referral, just put a note on there. Each of the different sites is having different deliveries, and we know some of the sites will have one particular or the other. So if you know you have an allergy to one, put that in, and we will try to ensure that you get routed to a site that is having the one that you are not allergic to the ingredients. Someone had asked about how do I find out what the ingredients are in the vaccine?
So it's on the specification, and they can be sent out. There's links to Pfizer and to AstraZeneca on that. There's somebody in the chat asking about they're having their thyroid removed and currently taking thyroxine. Can I find out which is the best vaccine? Either is fine. So there should make no difference on that.
Thank you. And just we're going to go to our person who's had COVID to give us to some feedback. But just one more question before we go to them. Is there a period of time after the vaccine that you will be vulnerable due to low immune system fighting off the vaccination?
Yes. Sorry, did you want to, Aditi?
No, you go ahead, Agnelo, that's fine.
Yeah, so we're finding out more and more. So Israel is the highest vaccinator in the world at the moment, and I think it's well over 14 million by now. And what they're showing is that after about the first week, you've got about 50% immune response. So after about 2 weeks, you're likely to get about 90 with the Pfizer vaccine, and from about up to about 74 to 80% with the AstraZeneca vaccine. So before that time, you can still get an infection. So the vaccine hasn't given them the infection. They could get infected after the vaccine or before they had the vaccine as well. So the optimum time to be feeling a bit more safer is at least 2 weeks after. The same after having the second dose. It's roughly about 2 weeks after the second dose. Then you can assume that you've got about 95% protection with the AstraZeneca, and about 90% with the with the Pfizer, and then about 90% with the AstraZeneca. So you get immunity really quickly, and that's really good to know. Thank
you. We'll just have a pause from the question for a moment. We're very fortunate to have Vanessa Vyapooree join us this afternoon, and she's actually had COVID, and just to tell us a little bit about her experience. So Jiggy, would you like to introduce Vanessa?
Thank you, Vicky. And thank you, Agnelo and Aditi, for sharing all the information and knowledge that you have on the COVID vaccine. It will give everybody the opportunity to make those informed choices. Agnelo, I understand that you do need to leave slightly early, so thank you for sharing what you have today. Aditi, I'm aware you may be able to go on slightly over if you're still available to do that, because I think we may run over slightly with the questions. Okay, I'll move on at the moment to Vanessa Vyapooree. Thank you so much for joining us today and to share your experience of having COVID. I'd like to ask you some questions, if that's okay, to share with the group. So would you be able to tell us a little bit about you, and then when you contracted COVID?
Yeah, sure. Thanks for having me on. So I am 43 years old. I work in the marketing arena. I run a creative agency, and I contracted COVID March last year, unbeknownst to me. We are not 100% sure how I got infected, because I was actually at home for 2 weeks before I got ill. The last meeting I had was the 5th of March, and my business partner who I had the meeting with, she tested negative, had no symptoms or anything. So we're not entirely sure where. We think perhaps I contracted it at the hospital when I first went to A&E. I went into A&E, and they, at the time I went in because I didn't have a cough or anything, and at the time the was very much look for a cough, and I think that was it, mainly a cough, somewhat breathing problems, but I didn't have really either of them. I had was feeling really quite low, fatigued. I had I think more like flu symptoms, what I thought was flu, and after about a week it gradually got worse, so we decided to go to A&E. Went there, they sent me home within a few hours. They did some blood, I think they did some blood tests, as they normally do. They did blood tests, sent me home, and then 3 days later, I just progressively got worse.
Yeah.
And my temperature shot up to 39.4. And at the time we were having work done in our home, and so we thought maybe the dust had gotten into my lungs, etc. And it's very likely that I had bronchitis at the time. Went into hospital, and within 5 minutes the doctor said to me, "We need to take you in. We're going to admit you into hospital, and we actually think we need to induce you into a coma." Which was a shock, because you don't expect to hear that within 5 minutes. And
how were you feeling? How were you feeling at this point?
At that point, I was absolutely exhausted. I'll be honest with you, I was exhausted. I was scared, but I also have faith in the doctor saying to me, you know, we need to put you on a ventilator. Your lungs need to rest. So yeah, so I went with it. I remember Dudley coming in, and he'd gone to park the car, and by the time he parked the car and came back to see me, they wheeled me out in a wheelchair and said, "Tell him to go home. There's nothing that he can do here." So he was confused himself. He literally threw a bag at me, and then was told to leave.
Yeah.
They called him when he got home and said, "We need your permission as my next of kin to induce her into a coma." To which he was shocked. He had no idea what happened as soon as I went to hospital, and this was a discussion. I signed forms. I don't remember signing forms at that point. I think I literally passed out.
Yeah.
Don't remember anything after that. So I woke up 3.5 weeks later, and to all intents and purposes, very, very lucky to wake up, because 4 days after they induced me into a coma, they called Dudley and told him that I wouldn't survive any longer than a few hours.
Could you tell me a bit, Vanessa, about what had happened during that time that you were in the coma? I mean, I know that you weren't aware, and Dudley, if you're happy to share what your experience was with what they were saying that they were doing to Vanessa at the time she was in the coma.
Hello, everyone. Yeah, Vanessa was, when they induced her, they obviously had given her and put her on oxygen and a ventilator, and they were trying and turning her body around on her front and then on her back to help with her breathing, to help her lungs take in oxygen. But it wasn't working. And as Vanessa said, 4 days later, I got the call that there may be hours for her to live, and I had to relay that message to her parents. And
that must have been an extremely difficult situation.
Yeah, I think sometimes some clinicians can be direct and to the point. And I think at the time, it's no easy way to tell someone that news. And especially, as we know, you couldn't visit the hospital, so you can only hear it over a phone, and you can't see anyone, and you haven't seen someone for 4 days. So it was very distressing.
Yeah, and really worrying for you to know that she was in that situation. Vanessa, going back to you, so you've obviously shared that you were on the ventilator, and what else did they do to you during that time to help you get through this?
So after Dudley was called to say that I wouldn't survive the night, a consultant came in from Royal Brompton. So I was at Chelsea and Westminster. A consultant came in from Royal Brompton, and he heads up the ECMO team. And at that point, they weren't sure whether ECMO was something that would actually help anyone with COVID, because it was very early days. And
can you give a brief outline of what the ECMO is to people who may not know?
Okay, so I can't remember the full name of it, but it's basically a machine, a super machine, and I think there's only 18 of them in the country, and it they insert tubes into you, into main arteries, and one tube takes out your blood. Cleans it, adds oxygen, and then pumps it back into your body. So it essentially acts as your lungs, where your lungs are unable to function. So it has like they call it they dub it the iron lung machine, because that's what it's doing. It's acting as your lungs. It allows your lungs to rest and recuperate fully, and it acts as your lungs. So obviously, as your blood is coming out of your body, there is a chance that vital organs can fail. That's actually what happened to me. My kidneys failed, and I was given dialysis for 3 days. I'm lucky to have full function back of my kidneys, very, very lucky. And they were concerned because I had quite a few nosebleeds. So I had a few brain scans as well, because they were concerned that I might have had a bleed in the brain. There's just various challenges that come with going on to ECMO, and it is a last resort machine. Not only to do with the cost or anything, because the machine costs a lot of money to run and to get in the first place, but actually it is a last resort for them to put me on that. So luckily,
when you came out of the coma, is that how many weeks were you, did you say?
3.5 weeks.
And when you came out, how did you feel, and what was your experience of when you woke up?
I thought it was 48 hours later, because that's actually what I was told, that it would be 48 hours later. However, it was 3.5 weeks later. I don't really remember too much of coming out of the coma initially. I just remember being really upset because obviously Dudley wasn't with me. My best friend, my family, I was there by myself with amazing NHS staff, but it was really scary. And I had no idea what I had gone through. I literally thought they'd put me into a coma, I'd been asleep, and I'd woken up again. So when they started talking to me about sutures, and I was thinking, well, why have I got why have I got sutures, you know? And then the doctor explained to me about the treatment that I'd had.
So, and thank you so much for sharing what's happened and that experience that you had. I know that you shared with me before that you are now experiencing long COVID, and that's affected you in multiple ways. You can share if you want to with everybody.
Of course. So when I first came out of hospital, I think about after a week or two when I came out, at first, actually, when I woke up, I couldn't walk because I'd been asleep for, nearly a month. So my muscles had gone to sleep. That was really scary. And they said it could take, up to 3 months to get my strength back. So when I got home from the hospital with Dudley's help, we did physio and everything, but unfortunately my left side has taken a bit of a battering, and I have a frozen shoulder, so I can't lift my left arm at all, past kind of elbow height. And it's really, really painful. I also have some nerve damage down my left leg, so that's quite irritating, quite painful at times. I also get shooting pains up my right side. It's like a sciatic pain that I get. I lost a fair bit of my hair, but that didn't worry me too much. It can grow back. I've lost around 60 to 70% of my hearing on my right side. And we're still awaiting tests to see if it's permanent damage, but it hasn't gotten better at all. And I'm still experiencing some mucus issues with my lungs, so that's still coming up. I think that's on. I get dizzy spells as well.
It's an ongoing and long-term situation that you're recovering from. And one last question I think that I want to ask you is, if you were if you'd been given the opportunity to have the vaccine before you had COVID, would you have had the vaccine?
Yeah, absolutely. There's no reason for me not to have had it. Yeah.
And have you had it now?
No, because I'm not. I'm actually not priority. I suppose because I've had it despite having a COVID a long time ago. But yeah, as soon as they send me the text message to say that it's available for me, I will be going. Yeah.
Brilliant. And I wish you both the best of luck, and thank you, Vanessa, for sharing your story with us.
Thanks for having us.
Thank you.
Yeah, thank you, Vanessa, and thank you, Dudley. Really powerful, isn't it, to understand just how devastating this disease can be. And Aditi, I think that really leads me nicely. One of the comments that's been put in, someone has said that people are afraid of the health complications after having the vaccine. I mean, just hearing what Vanessa has been through, the health complications of having COVID, I mean, how can the health complications after having a vaccine compare to having what can potentially happen with COVID, Aditi?
Vanessa, thank you so much for sharing your story. And I can, although you look beautiful on the screen, I can tell that you've gone through a tremendous journey over the past few months. And I think that just echoes the consequences of COVID-19, that for a lot of people it can be really devastating in terms of the impact on your health, and that balance with having a vaccination that can reduce the severity of the disease. And you might have some side effects like a little bit of localized reaction at the site of the injection, a little bit of a temperature, you might get some fatigue, and you might get some headaches. Those are the common types of side effects that people experience. But actually, it's about balancing up things, isn't it? And certainly compared to what Vanessa has gone through, I think the side effects of having a vaccine for the majority of people compared to the impact of COVID is you just can't compare the two, really, can you? And obviously, I think I think it's you're only human if you're scared, and I can understand why people are scared of having the vaccination. I think we all go through that process. I think every single person who's had the vaccination has probably gone through in their mind, okay, it's time for me to have it. I'm a little bit worried about it. And then you go up through weighing up the pros and cons in your head, and you get all this information. And what I would say is ignore all the rubbish that comes through social media and all the sources that may not be genuine information, because there is a lot of rubbish out there. And the problem is that sometimes then affects the decisions that we make, and clouds our judgment a little bit. Go to reliable sources, go to places that are trustworthy, whether it be approved medical information, speaking to healthcare professionals, coming to groups like this where you can speak to people who are involved with the vaccination process, and use that information. Because I think, sadly, this misinformation keeps on going around, and certainly we see that, but especially in community groups, we're also intertwined and interlinked, and suddenly one WhatsApp message goes around the world and it's got the wrong information in it. So I would urge you to go to genuine sources of information to help you make that decision. But absolutely, Vanessa's story is so powerful, and I think that hopefully it will highlight how important the vaccination process is, not only for yourself and to protect yourself, but also protecting others as well.
Thank you, Aditi. I realise we're just on 4 o'clock and we haven't even had a chance to open the lines. Is there anyone who's phoned? Because have you got a couple of minutes, Aditi? Please let me know.
10 more minutes, yeah.
Thank you. Is there anyone who's on the phone or who hasn't been able to put their question in the chat who would like to ask a question of Dr. Aditi Shah? Lawrence Heraldon, I'm not sure if you've had your hand up the whole way through or if that was a...
Hello?
Hello, please ask, caller.
Yeah, hello?
Hello, please go ahead.
Yeah, my name is Funke. I work in a care home, and I would like to ask a question about the vaccination.
Go ahead.
Yeah, so I'm a bit skeptical about taking the vaccination because my home is having it tomorrow, and I kind of want to know the pros and cons of the vaccination because on the news today I actually heard about something about fertility in regarding about giving birth in future. It is going to have a disadvantage on that, so I really want to learn more about that before consenting to having the vaccination. So I really want to know the pros and cons of having it because I'm a mom of one, and definitely in future I still want to have children. So I want to know the pros and cons of it before I consented to it.
Thank you. So I think the simple answer to that is there is no evidence to suggest that it causes any problems with your fertility at all. Yeah. If you do get pregnant, then if you and get COVID, then the impact of COVID itself is similar to other women. However, if you're pregnant and you have COVID and you are from a Black, Asian, minority or other ethnic group, if you're overweight or if you're an older woman who's pregnant, then the impact of COVID-19 on you is more significant. There was a study that was done looking at specifically pregnant women. They looked at over 400 women. It was run in Oxford, and they found that with those specific groups, the impact of COVID can be more severe. So I would say that in terms of protecting yourself, this is it's really important to do, and certainly all the studies so far, the evidence has not caused any concerns about fertility, but this way the vaccine will protect you from the severity of COVID-19. Does that make sense? Does that answer your question?
Yeah, it does. So it doesn't affect anything in the future about fertility.
So all the information so far has said that there is no impact on your fertility. All the information says there's no impact on fertility. But if you're pregnant, then and you're having the vaccination, then discuss it with a healthcare professional in that way.
Okay. Just a quick question at the moment, because I've got the implant in me. Does it affect it or it doesn't?
Sorry, the line's not great. I don't know, Vicky, did you hear? Sorry, the line's breaking up.
Implanol. She's got Implanol in her arm.
Okay, so you were asking about the impact of that. There is no impact on that at all.
Okay. No impact on the implant on my arm. So I can go ahead.
Did you mean it because of the location of the implant? Is that what you were worried about?
Yeah, it's on the left. It's on the left arm, but definitely I can have it on the right arm. I'm just asking, would there be any contractions?
Contraindications.
Okay, so in terms of having the implant, that is not a contraindication to having the vaccination done. By all means, let the person who's giving you the vaccination know that your implant is in that location. But to be honest, the location of the implant compared to where you have the actual jab are different. So there shouldn't be any issues at all in terms of physically the needle going into your arm when you have the vaccination. But you can have an implant and you can have the COVID-19 vaccination fine. You can have either of them, the AstraZeneca or the Pfizer one, and they would be absolutely fine with a contraceptive implant.
Okay. All right. Thank you.
No problem.
Thanks.
Yeah. Thank you. Bye.
Thank you.
Yeah, bye.
Is there anyone else on the phone line who would like to ask a question?
Yes, I would like to ask a question.
Yes, please.
Yes. Good afternoon. I have recently had some occurrences with my iron levels, and I recently had 2 infusions, and I wanted to know if there was any studies into if the vaccine would possibly affect the infusions in my body. I had issues with my iron levels and my hemoglobin levels.
Thank you for asking that. So the vaccination won't have any impact on your iron levels. If you have a specific concern about your iron levels overall, generally, then obviously speak to the healthcare professional that's looking after you. But certainly from the vaccination perspective, that will be absolutely fine to do. There are certain blood conditions where it's a good idea to speak to your specialist. But if it's specifically low iron levels themselves, then absolutely fine to have the vaccination there. Does that answer your question? Again, sorry, the line's not completely clear, so I hope I've heard correctly, if that's what you're asking.
Yes, yeah, that's the answer I wanted to my questions. Sorry, I'm at work at the moment. Yes, yeah, I'm quite concerned if there would be any impact on my anemia, if it would get worse, or I also have fibroids as well, and I don't know if then there will be an impact on the growth or issues with that. So
obviously I want to respect your privacy as well, because this is an open forum, and I'm so in general terms, everything you've said would not stop you from getting the COVID-19 vaccination at all. However, if there are specific concerns you have about your own personal health that you want to talk about, then it's perfectly fine to speak to the healthcare professional looking after you, just to discuss those one-to-one concerns that you have, because they have access to your healthcare records. But certainly from a general perspective, if you have fibroids, if you have a contraceptive implant, if you have a slight iron deficiency, all of those things are absolutely fine in terms of getting the Pfizer vaccination or the AstraZeneca vaccination, or others that might come in the future. So those should be fine to have in all of those circumstances that you've described. But if it's more specific detail you want, I would suggest speaking to the specific healthcare professional that looks after you.
Okay, thank you. Thank you.
And I think, should we maybe just take one last one on the phone, Aditi, because I'm aware we've run over a little bit, and I know you've got your next things to tend to. Are there any last questions on the phone people would like to ask?
Yes, please.
Go for it.
Can I go on?
Yes, please.
Yeah, just a quick one. Wanting to find out, does an individual have a preference to choose which of the vaccines he or she would like to have?
So as we've said before, both of them are completely safe. There's been a lot of research and trials looking at them, and they are both approved and safe to use. So what I would say is that I would I would just go for the one that is available on the day. Your question about can you choose between the two, there are certain circumstances where one you might have to have one. So for example, if you're allergic to the ingredients in the vaccine itself, or if you're in the Pfizer one, there's sort of a list of ingredients which we can supply. We can share that list with you, and the same with the AstraZeneca one. So those are the times that you may have to choose one compared to the other because of your medical condition. But otherwise, the recommendation is just you can have either of them, really. Was there a specific reason you were worried about choosing between the two?
Not really, but in case I have the right to choose.
So when you do I was going to say, just when you put in your request, if you have a reason, if you have an allergy to one of the ingredients in one of the vaccines, just put a note when you make your request through, because the different clinics are using the different ones, and they even change from week to week. But obviously we can just try to support that to get you to a clinic that has, if you've got an allergy to one, to try to get you to a clinic that has the other one. It may just mean it's a little bit toing and froing to get you to when they have that delivery, but yeah.
But otherwise, I think if it was just because you were wondering which one to have between the two, I would say either of them. Like I don't know if you were on the call before, but I said before that I had one of them and my husband to have the other, and it was purely that was what was available at the clinic when we went. And so and we would do the same again. Really, we would just go with what's available unless you have a allergy or a specific medical reason for that.
Oh, okay. Thank you very much for your answer.
Welcome.
Thank you. And I realise we have run over a little bit, and I'm sure that people. I hope that the information that we've given and answering the questions has been helpful to people. And a huge thank you to you, Aditi, and to Agnelo, who's had to leave, and also to Vanessa and Dudley for sharing their story. We've all found it really valuable to get the information and have that opportunity to ask questions. And if people do have more questions after this, Aditi, what would you suggest that they do?
Yeah, so I mean, I wanted to thank you all for spending this time finding out more, because I think that's really important. It's really important to arm yourself with that information so that you can make the correct decision for yourself. And I really hope that we've given you the correct information to make a decision that's so important for you, but also for your loved ones as well. And I think Vanessa's story was really, really powerful. There are lots of sources of information. Perhaps after this we could share the AstraZeneca and the Pfizer information sheets anyway. But also if you go to the NHS website, it goes through the two vaccinations there as well. As I said before, you heard me say this, and I'll repeat it again, please don't trust the rubbish that's going around in terms of fake news, social media, all of those things. If you want links to reliable websites where it's got information that is correct and accurate, we can send those to you, and that gives you time in your own space to read about them, such as the NHS website. Some of the other ones I've come across are the British Heart Foundation one I found really helpful. And there are organisations like that that have really, really helpful links to them. The other thing is that some of you have mentioned about speaking different languages, and there is information, really helpful resource on the BBC, which is they speak in different, especially Asian languages, about the COVID vaccination, and translate all the myths and explain what the actual correct advice is. And again, I'm very happy to share the links with you there for that as well. And please keep asking. There are people coming into care homes to vaccinate residents there. They're always amenable to answering your questions. And I'm sure Vicky and her colleagues, if there are specific queries, concerns that are coming up, then please do let them know, and then we can try and find a way to answer those as well for you. I really hope that this has given you some information to make the right choice for yourself. And thank you for spending an hour in what is an incredibly busy time for all of us. And thank you for all the hard work that you're doing in the background there as well.
Thank you very much, Aditi. That's really helpful for having you today. And what we'll do is send out those links back to it's back to the agency, so it'll go back to the managers. I realise there's staff at the coalface here, so and we'll ask them to share them with staff who attended this today, and also people who weren't able to attend today. So thank you. So huge thank you, Aditi. Thanks, Jiggy, for your organisation, and yeah, thank you to everyone for coming along, and thank you so much for the valuable work that you're all doing. It's such an important job you're doing, caring for some of our most frail, our most vulnerable individuals, and it's been a long, hard slog, hasn't it, for all of us? So keep up the good work and keep safe.
Thank you. I just wanted to share Aditi as well. Thank you for sharing your knowledge. And Vanessa and Dudley, I wanted to say a big thank you as well for sharing your very personal story with everybody. I forgot to add earlier that, as we all know somebody who has either experienced COVID, or we know of somebody who's experienced COVID. And you can have no symptoms, be completely asymptomatic. You
Oh, we just lost you, Jiggy. Sorry, it's gone onto mute.
Hello, sorry. As you all know, some of you have some people can have mild symptoms, and some people can have symptoms very badly, such as what Vanessa has shared with us today. So just take all those precautions, as I know you probably all are doing as much as you can anyway, but share that with your colleagues to wear the mask above your nose. Don't keep it under your chin. Wear gloves when you need to and when you're doing those specific procedures, and just follow all those guidelines to keep everybody around you safe and the people that you care for. Thank you.
And take up the offer of the vaccine.
And take up the offer. Yeah, absolutely.
I'm sure I'll see some of you when I'm vaccinating. I look forward to meeting you in person if I do.
Thank you. Thanks a lot.